Welcome back again, guys. Now we're going to talk about hemodialysis and peritoneal dialysis. So I think I'll start off first with peritoneal dialysis. So peritoneal dialysis is literally using the abdominal cavity or the peritoneum to infuse what is called a dialysate into this cavity in order to clean the blood, and then this will be further emptied. And this will be emptied at a later time. Alright, so there's one big issue with peritoneal dialysis, and that is peritonitis. Peritonitis is basically infection of the peritoneal cavity. Alright, so for peritoneal dialysis, surgically inserted tube into abdominal cavity for infusion of dialysate. Infuse 1 to 2 liters by gravity over 20 minutes. Dialysate dwells in abdomen over a specific period. So you just need to understand that the peritoneal dialysis uses dialysate, which is infused into the abdominal cavity to clean the blood and is later emptied. Alright, so once you have completed your dwell time, it's time to drain the fluid. So the effluent, which is called the drainage from the abdominal cavity, may contain excess water, electrolyte, and nitrogenous waste. One big tip for you guys: if the dwell time is, say for instance, 2 hours, make sure it is emptied after that 2 hours, because what can happen is that the concentration gradient may even out and you can actually introduce back waste into the blood. So you have to follow the dwell time. Alright, the number and frequency of exchange depend on the client condition and lab data. So if someone is eating a proper diet, diet low in protein, but a nutritious diet, you might not need such a long dwell time, while others who have more buildup in the body may need a longer dwell time. So whenever you are on peritoneal dialysis, there are some manifestations of peritonitis you should look out for, which is cloudy outflow or cloudy effluent. Keep in mind, guys, it is normal for the effluent to be either clear or straw colored. Clear or straw colored does not indicate infection. So remember, if it's cloudy, then there's a problem. But if it's clear or straw colored, then you're fine. You may have rebound abdominal tenderness, abdominal pain, general malaise, nausea, vomiting, because of course you have an infection in the body. Alright, so some other complications that are associated with peritoneal dialysis include pain when infusing the dialysate. So keep in mind, whenever you're infusing a dialysate and the patient is experiencing cramps, please slow down the rate that the dialysate is being infused. Also, make sure that the dialysate is at room temperature or warmed. Alright, a cold dialysate may cause cramping, discomfort, and pain. A person may also experience insufficient flow of dialysate, which meaning there is some form of occlusion somewhere. So it is most important whenever you are draining the dialysate or the effluent, if there is a decrease in effluent drainage, please check for kinks in the tube. So first you check and see if there's any obstruction along the tubing. If there's no obstruction noted, turn or change the position of the patient. Sit them up. Maybe they were lying down. Maybe, the drainage bag was too high. So make sure you first check for kinks in the tubing. If everything seems okay, you change the position of the patient and see if there's an increase in the outflow of effluent. Alright, whenever you're caring for a patient with peritoneal dialysis, you have to be extremely careful and practice proper hygiene in order to prevent the introduction of bacteria to the patient. So, must wear a mask. Put on sterile gloves. So is this a sterile procedure? Yes. Alright, so assess the area for signs of infection, swelling, redness, or discharge from the catheter. If any of these are noted, it might be a sign of infection, so make sure you pay attention to these. So swelling, redness, discharge around the catheter. So what kind of gloves are we going to use for peritoneal dialysis? Clean or sterile? Sterile gloves. So, caring for the site, always make sure you clean around the catheter. You can use providine iodine and apply sterile gauze around the area to help to prevent irritation of the area. Alright, so before you start the treatment, there's some things that you need to keep in mind. You have to make sure you monitor vital signs, weight, and lab values. So, are you going to do this before you actually start the treatment? Yes. So, 3 things. Monitor vitals, weight, and lab values. During the dialysis, continually monitor the patient, check vital signs regularly, assess for pain, assess for catheter leakage, or assess for any complications that are out of the norm. Monitor the dwell time and document. As I said before, the dwell time has to be accurate in order to prevent equilibrium of the concentration gradient, and that can cause a problem. Record the outflow and the clarity of the effluent in your intake and output. So, if you infuse 500 mLs of dialysate, for example, and you get back 800, then you know you're gonna have an output of 300 mLs. In the same instance, you might infuse 500 ml of dialysate and you only get back 300. The 200 did not just evaporate or disappear out of nowhere. It's somewhere, so you, as I said, check for kinks in the tubing or reposition the patient to see if you can get out this extra effluent. So let's talk about hemodialysis. So in hemodialysis, you create a vascular access with an artery and a vein, and this is termed atrioventricular fistula. Alright, so as I said, it's the anastomosis or the joining of an artery or a vein. So before you start a hemodialysis treatment, you always have to assess for a thrill and a bruit. If these are absent, then you know that there is a problem going on with the AV site. This person might also experience some complications from having an AV fistula, which includes thrombosis or stenosis, infection, aneurysm formation, or ischemia. These problems have to be corrected as soon as possible, because once you have some form of complication going on with the blood or the vascular access, it can easily travel to the lungs, to the heart, to the brain. It can cause a lot of complications. Alright, some things to keep in mind whenever you're on hemodialysis. You have to use heparin. Heparin is usually administered concomitantly with the treatment because this helps to prevent blood coagulation, which can lead to blood clot. Avoid invasive procedures 4 to 6 hours after you have had hemodialysis, because remember again, you were just on heparin. If you're on heparin, you are at risk for bleeding, so you don't want to do any invasive procedures. Monitor for hemorrhage again, because as I said, there was heparin introduced during the process. And assess for disequilibrium syndrome. So disequilibrium syndrome means there was a change in the amount of, I would say, toxins that were in the body. So basically, if you have a high concentration of toxins in the body, if you get rid of this too quickly, then you will have a disequilibrium syndrome. It has to be a gradual procedure. Alright, some signs and symptoms of disequilibrium syndrome include nausea, vomiting, headache, restlessness, coma, or even seizures. So you have to keep in mind this should be a slow procedure. Alright, so post-peritoneal dialysis. So assess for any complications. Hypotension, you have just got rid of some fluid from the body and toxin. Assess for headache, as I said, nausea, vomiting, malaise, dizziness, muscle cramps. These are some signs and symptoms of disequilibrium syndrome. Okay, importantly, when someone is on hemodialysis, make sure or ensure that you measure their weight pre and post procedure. Also keep in mind, withhold any medication that this person might possibly be getting, because the hemodialysis may filter out this medication, or it can make the patient bottom out. Say for instance, if this patient is hypertensive and they're on antihypertensive medication, if you give this medication before hemodialysis, the patient may have a severe drop in their blood pressure, and this can cause the patient to bottom out. So you don't want that to happen. So withhold all medication before the procedure. Alright, so there's another option for people who experience chronic renal failure. They may be eligible to get a renal transplant. So this patient have to be free from medical problems. They cannot be drug abusers. They cannot have any underlying infection. They cannot be severely obese, and they cannot have any malignancies going on, because, as I said, this is a dangerous procedure. Once anyone gets any type of organ transplant, they will more than likely be on immunosuppressants. So they have to be free from all medical complications. Alright, so for your donors, someone who is kind enough to donate a kidney, they must be absent from any infection. They must not have any systemic conditions, underlying complications, because they're about to lose a kidney. So they have to be in good health. Alright, so a person who got a renal transplant, so there's some few complications that they may develop. One is the rejection. So rejection usually occurs because the body notifies this organ as a foreign body. So in order to prevent this, the recipient of the organ usually is on immunosuppressive, as I said earlier, and they're usually on corticosteroids to prevent an autoimmune response to the transplanted organ. You might have renal artery stenosis, which means that blood is not getting to the kidney adequately. So this person may develop hypertension because they are not diuresing, or they may have a decrease in renal function. So post-op care, make sure you monitor vitals as usual. Renal function, your intake and output is very important for a person who just received a kidney. So note your urine color, odor, anything unusual, sediments in the urine. You have to make note of all of this. So once again, after a renal transplant, you have to monitor daily weight to see if there is any fluid retention going on with the patient. Monitor electrolyte imbalances, especially your potassium, because it can lead to serious arrhythmia. So patient teaching, medication, do not skip your medication. Diet, you have to make sure you eat a balanced diet, usually decrease in protein, because the protein, too much protein can also cause damage to the kidney. And basically management of the new transplant. I hope that this review was helpful to you guys. Whatever questions you guys have, leave in the comment below. If there was something that you need for me to clarify, you can leave a comment below also. I hope you guys enjoyed this video. Make sure to subscribe, like, and leave a comment, as I said. And take care, and all the best.